Okay, let's think about how we usually evaluate a new health initiative. We often focus so much on the end results, right? Did patient health get better? Did we save money? But what if, the really valuable stuff, the messy real world learning about how something worked or maybe why it didn't just gets lost along the way? That seems like a huge gap.
It really is. Your standard evaluation methods, they can be very rigorous, sure,
Yeah.
but they often start with fixed ideas, hypotheses, sampling plans, set up before anything even happens.
Yeah.
And that kind of rigidity, well, it just doesn't mesh well with how healthcare actually works day to day. It's constantly changing. So yeah, you end up missing these critical real-time insights into what makes an innovation tick or fail.
Right. So if those traditional ways leave gaps in our understanding, what's the alternative? That's what we're diving into today, this idea called learning evaluation. It sounds like it's really designed to capture those vital evolving insights as they happen. Kind of a shortcut for you to understand healthcare innovations more deeply, not just the final score. Learning evaluation seems to really shake things up by blending the best parts of quality improvement with solid implementation research. It's not just about studying things from afar, it's about generating useful, actionable insights right from where the work is happening.
Exactly. And what's really interesting to me is how it tackles that disconnect between, the plan on paper and the reality.
Mm.
One of its key ideas is really digging into these multi-level contextual factors.
Mm.
And we're not talking about just the big picture stuff. It's about this specific vibe in one clinic versus another, the team dynamics, maybe staff changes, local rules, even the specific patients they see. It's these sort of underlying forces that often decide if something works, and learning evaluation brings them out into the open.
And it's not just watching, right? That's crucial. It actually helps organizations use their own data to keep improving, empowers them to tweak things as they go. Plus, it standardizes how you measure these insights. So what one place learns isn't just stuck there, it can be shared, applied elsewhere, like building a shared knowledge library, step by step.
Yeah, precisely. It shifts the main question from just, did it work,
Hmm.
to something more nuanced, like what works, under which conditions, and for whom. In practice, this often starts with really understanding the initial plan, who it's for, then rigorously tracking the process measures, the things that show how the work is being done, and crucially, collecting both numbers, quantitative data, and stories, qualitative data, about those context factors while everything is happening.
That real-time aspect does sound powerful. But, for places maybe with tighter resources, how do they actually manage all that incoming information without getting bogged down?
That's where the blended approach really helps. Think about the ACT program Advancing Care together. They were integrating primary care and behavioral health, a big task. Learning evaluation let them gather qualitative stuff, like through online diaries from staff or interviews, seeing the exact changes clinics were making. And at the same time, they pulled quantitative data from the electronic health records, things like screening rates.
Okay, and then this seems key. They didn't just sit on that data. They synthesized it and shared it back with everyone involved continuously.
Exactly, that ongoing feedback loop. It helped each site learn as they went. They used tools, sure, like run charts to see trends in the numbers, but they overlaid that with the qualitative insights, the why. So they could ask not just did screenings go up, but why did they go up so much in this clinic but maybe stall in that one? Adds the crucial context.
Okay, so let's wrap up this deep dive. Learning evaluation. It's really this smart mix of quality improvement and implementation research. It pushes us past the simple did it work question to asking, much more usefully, what's working, where, and for whom. It builds this living understanding.
hmm And its real unique strength is doing two things at once. It helps individual sites learn and adapt continuously, making them stronger, but it also produces systematic findings you can actually transport and use across different organizations.
Mm.
It boosts capacity and really speeds up how we apply new knowledge.
So here's something to think about. As you see new projects or changes happening in your own work, just consider how much valuable real-time learning might be slipping through the cracks if the evaluation isn't built to be flexible, to be responsive. How could adopting something like a learning evaluation approach change the game for understanding what truly makes an impact and maybe help speed up progress where you are?